It always started with the same thing: sweaty palms, racing heart, and a voice in her head screaming, "Don't mess this up. They're watching. They're judging." Emily was only 14 when she began avoiding school presentations. By 16, she refused to attend birthday parties. By college, even ordering coffee felt like a performance she couldn't bear. This is not just shyness. This is social anxiety disorder, and Emily's story mirrors the silent struggles of many people. From the outside, Emily looked like a typical teenager, but inside, she was trapped behind an invisible wall of fear. Social anxiety disorder is not just nervousness. It's an intense, persistent fear of being watched and judged by others. It hijacks your voice, your confidence, and your relationships. For Emily, even walking into a room where people might glance at her caused her stomach to twist into knots. At school, she sat at the back, afraid to raise her hand. When teachers called on her, her face flushed, her mind went blank. And after every interaction, she replayed it endlessly. Did I say the wrong thing? Did I look stupid? Did they laugh when I walked away? By college, Emily mastered the art of avoidance. Group projects, she picked the quietest role. Social events, always an excuse. Even calling to schedule a doctor's appointment caused panic. She missed out on friendships, relationships, even job opportunities. Social anxiety disorder affects about 12% of people at some point in their lives, often starting in childhood or adolescence. And yet, many suffer in silence, believing it's just who they are. But it's not a personality trait. It's a treatable mental health condition. It wasn't until Emily had a panic attack before a routine classroom debate that she finally opened up to her counselor. With time, assessment, and honest conversations, she was diagnosed with social anxiety disorder. Understanding her condition changed everything. Her fear wasn't weakness. It was the brain's overactive response to perceived threats, a survival mechanism stuck in overdrive. She learned about the amygdala, the brain's fear center, and how it reacts excessively in people with social anxiety. Naming the fear gave her power. Emily began cognitive behavioral therapy, CBT, the gold standard treatment for social anxiety. Through therapy, she identified negative thoughts and began replacing them with more balanced ones. When her brain whispered, "Everyone thinks you're awkward," she learned to respond, "Maybe." But people are usually too busy thinking about themselves. She also practiced exposure therapy, starting small, like saying hello to a cashier, then building up to conversations with classmates. Each success, no matter how tiny, chipped away at the fear. Some days were hard. Sometimes she regressed, but she kept going. Her doctor recommended trying an SSRI, a type of antidepressant often used for anxiety. For Emily, the medication helped take the edge off. She also learned mindfulness techniques, breathing deeply, staying present, and grounding herself in reality. Practices like meditation, journaling, and limiting caffeine made a real difference. By 22, Emily stood in front of a small crowd at an open mic event. Her voice trembled, but she spoke. "I used to think I was broken," she said, "but I was just scared." And scared doesn't mean incapable. The room clapped, not because she was perfect, but because she was real. Social anxiety disorder didn't disappear, but it stopped running her life. If Emily's story feels familiar, know this: you are not alone, and you can reclaim your life. Here are some actionable steps you can take today. 1. Talk to a professional. Start with your family doctor or a mental health counselor. Diagnosis is the first step. 2. Try CBT. Cognitive behavioral therapy is highly effective. Ask about therapists trained in CBT or exposure therapy. 3. Consider medication. SSRIs or other anti-anxiety medications may help. Discuss options with your doctor. 4. Practice exposure. Gradual, repeated exposure to feared situations helps reduce anxiety over time. 5. Use grounding techniques. Try deep breathing, the 5-4-3-2-1 method, or holding a comforting object. 6. Limit caffeine and alcohol. Both can worsen anxiety symptoms. Social anxiety disorder doesn't mean you're weak. It means your mind is trying to protect you a little too much. Like Emily, you can learn to live beyond the fear. Like this video if you found it helpful, and be sure to check out our other videos.